Good evening. People 40 years of age and older will now be allowed to receive a COVID-19 vaccine. The province announcing that age group will be eligible for the AstraZeneca shot starting on Tuesday. Now, this comes following an announcement by the federal government offering more support for Ontario as the province struggles to get a grip around COVID-19. The Ministry of Health announcing the AstraZeneca shot will be offered at pharmacies and primary care centres to those 40 and over after the federal government said Ontario is free to expand eligibility to any adult over the age of 18.
Provinces and territories are free to use AstraZeneca in any age population over 18 as per Health Canada's license for use in Canada.
Provincial officials say the decision to drop the age was based on current supply of the shot. Right now, AstraZeneca is only offered to those 55 and older, which is in accordance to the recommendation being made by the National Advisory Council on Immunization.
NACI provides recommendations based on the current evidence and evolves their advice as new evidence comes in. In fact, they are reviewing AstraZeneca advice now and will have an update in the near future. But there is nothing stopping the province of Ontario for changing their advice for use to their physicians within Ontario.
This change comes as the province continues to struggle with record high cases of the coronavirus and surging hospitalizations of those infected. Today, the federal government said it would be stepping up its efforts to help Ontario.
First, we are mobilizing federal healthcare workers from across government departments to deploy to the front lines in Ontario and specifically the GTA, where the situation is most critical.
Trudeau also announcing the feds will be working with municipalities and boosting the capability of more rapid testing in hotspot areas with a focus on essential workers. The federal government says it will also cover all of the costs to mobilize staff.
Canadians across the country aren't just watching the situation closely, they're springing into action to help. There are provinces that have managed their healthcare capacity for their own local situation and have the ability to lend a hand to others.
The province responding to the help with a statement from the Minister of Health, which reads in part, as Ontario battles a third wave of COVID-19 driven by variants, we are grateful for the support of the federal government. We continue to take the necessary actions to expand capacity in our healthcare system and enhance public health measures. There has been some hesitancy to accept the AstraZeneca vaccine due to a very rare blood clotting condition, which has so far affected 2 Canadians. More than 700,000 doses of AstraZeneca have been administered in the country, and many physician and health officials encourage people to accept the shot they are eligible for.